Should I exfoliate and how often?
With exfoliation, there's not a simple answer because there are so many types of exfoliating products out there, and there are also so many different strengths of exfoliating chemicals. When you look at exfoliation, there's two categories. There's physical exfoliation and chemical exfoliation. When you look at physical exfoliation, the things that I think about are like beads or brushes, things that like kind of scrub the skin. And then chemical exfoliants include things like alpha hydroxy acids, which can include things like lactic acid, glycolic acid, mandelic acid, as well as beta hydroxy acid, which the prime example is salicylic acid. Then there's also polyhydroxy acids like gluconolactone. When it comes to deciding which category we prefer as dermatologists, I think we usually prefer the chemical exfoliants. Even though the word chemical can sound kind of scary for some people, you can control the strength that you're using, and they can potentially be more gentle on the skin, and they may have other benefits besides actually exfoliating the skin. Certain alpha hydroxy acids can also help build collagen. Polyhydroxy acids can also hydrate the skin. Beta hydroxy acids have other properties that can help with acne and pores. To answer the question, I'm going to talk about it more in terms of chemical exfoliants. In terms of how often to use chemical exfoliants, it really depends on how strong the chemical exfoliant is, what the chemical is, and how sensitive your skin is. If you are just starting out, I would recommend looking for a lower strength exfoliant, something with a lower strength alpha hydroxy acid, a lower strength glycolic acid, or if you have really sensitive skin, I would look into the polyhydroxy acids. You could potentially use these products every day. The other factor that plays a role in terms of how often to use exfoliating products is what other skincare you're using. If you're using a retinoid, a lot of times I'll tell patients, don't exfoliate the same night you use a retinoid. But over time, if your skin is comfortable with the retinoid and with the exfoliant, you can potentially use both on the same night. Now, there are much stronger chemical exfoliants out there. I would say, alpha hydroxy acids greater than 10%. And I would say if you are using something stronger, to really just reserve those once or twice a week, and to also avoid retinoids when you use those at night. If you're dealing with acne prone skin, I think that a lot of patients can tolerate using a beta hydroxy acid or salicylic acid daily, potentially along with some type of retinoid in their regimen. You don't want to incorporate multiple actives into your regimen at once. Start with an exfoliant, see how you do, use a retinoid, alternate nights, and eventually you can potentially use both at the same night.